A clicking jaw might not seem like a big deal, especially if it doesn't hurt. A lot of people hear popping or clicking for years, but just ignore it. But in many cases, that sound is your body telling you that the joint is not functioning ideally anymore. And sometimes that small click is the beginning of a much bigger problem. Hi, I'm Dr. Jeremy Manuele, board-certified orthodontist and dentofacial orthopedist. And if you're new here, it's probably because we're a new channel. So if this information is helpful or it helps you, be sure to share and subscribe so we can continue to put out content like this for you every single week. Okay, so before we talk about why the clicking matters, we first need to understand what the jaw joint actually is, because most people think the jaw works like a simple hinge, and really, it doesn't. Your jaw joint is called the temporomandibular joint, or the TMJ. You have one on each side of your head right in front of your ears. And these joints are incredibly complex. They allow your jaw to open, close, slide forward, shift side to side, rotate, basically everything you need to chew, speak, swallow, yawn, and function normally throughout the day. Now, what makes the TMJ unique is that there's actually a small cartilage disc that sits between the jawbone and the skull. Think of this almost like a cushion or a shock absorber. That disc helps the joint move smoothly and evenly while also distributing force during functioning. When the joint's healthy, all this happens quietly. You don't think about it, but when clicking develops, it often means that the disc or the movement around it is no longer perfectly coordinated. Something is shifting, slipping, catching, or snapping back into place during opening and closing. And that's why the click itself usually isn't the real issue. The mechanics causing the click are. Now, if you're seriously considering improving your bite, airway, facial balance, or long-term jaw function the right way, our team at Hamilton and Manuele Orthodontics can help. So if you're here in Las Vegas, head over to hmortho.com to book an in-person consultation. And if you're not local, head over to vegasorthodoc.com. There you can upload your records securely and we will review everything together remotely. Okay, so what actually causes the clicking? One of the most common reasons is something called disc displacement with reduction. Sounds complicated, but the concept is actually pretty simple. Basically, the disc inside of the joint may sit slightly out of position when your mouth is closed. And then when you open, the jawbone catches the disc and that disc snaps back into place. That snapping movement creates the click. Now, when you close again, the disc may slip forward again and repeat the cycle. Some people live with this for years and never really develop any major symptoms. Others slowly start noticing soreness, muscle tightness, headaches, pain, fatigue while chewing, or limited opening over time. And the reason this matters is not because every clicking jaw becomes a disaster. It's because clicking often means the joint mechanics are no longer ideal. And when something functions abnormally thousands of times per day for years, eventually the surrounding muscles, joints, and tissues may start reacting. It's kind of like driving a car with poor alignment. The car may still drive fine for a while, but over time, other parts are absorbing stress that they weren't designed to handle. Now, one of the biggest mistakes people make is assuming, well, it doesn't hurt, so it must be okay. But pain is actually a very poor early warning system. A lot of structural problems begin long before pain shows up. Some people may click for years while muscles around the joint are slowly tightening to compensate. They may start clenching at night without realizing it. They might chew on one side more. They might wake up with headaches or neck tension and never connect it back to the jaw. Pain is often the later stage symptom. Mechanical dysfunction is often the earlier stage symptom. That's why I pay attention when patients describe popping, clicking, shifting, fatigue, instability, or even locking, even if they say it doesn't hurt yet, because the absence of pain does not automatically mean the absence of a problem. And here's where things become even more connected than most people realize. The jaw joint doesn't work alone. It's connected to muscles throughout the face, temples, neck, shoulders, and even posture systems. When the joint becomes unstable or inefficient, the muscles often start compensating. That compensation can often contribute to temple headaches, jaw soreness, tight neck muscles, ear pressure, facial tension, clenching, tooth wear, fractures, gum recession, and even bite instability over time. Some people notice their jaw gets tired while chewing steak or gum. Others feel tension after talking for long periods of time. And some patients may even progress from clicking to actual locking episodes, where the jaw catches and temporarily won't open or close normally. And this is the stage where many people suddenly realize, okay, maybe that clicking wasn't something I should have ignored. Sometimes what happens is that the disc stops snapping back into place. The old clicking stage transitions into a restricted movement stage. And interestingly, sometimes the clicking even disappears when this happens, which fools people into thinking the problem improved. But sometimes silence isn't improvement. Sometimes the mechanics simply change. Now, does that mean every clicking jaw requires aggressive treatment? Absolutely not. A lot of clicking joints can be managed very conservatively, especially when identified early. But I also don't like when people normalize dysfunction because it's common. Common does not always mean healthy. About half of the population probably has some degree of TMJ clicking at some point in their life. But that doesn't make it ideal. If your knee clicked every single time you walked and occasionally felt unstable, most people would want to understand why. Your jaw deserves the same respect, especially because you use it literally all day, every day. So what actually contributes to these problems? It's usually not one giant event. It's cumulative stress over time. Things like clenching, grinding, emotional stress, airway problems, unstable bites, missing teeth, poor sleep, trauma, nail biting, chewing ice, excessive gum chewing, and or chronic muscle tension can all overload the system over time. Think of the TMJ like any orthopedic structure in the body. It tolerates stress until it doesn't. For some people, the threshold is very high, but for others, enough small contributing factors stack together and the system starts breaking down. So what should you actually do if your jaw clicks? First, don't panic. Second, pay attention to patterns. Is the clicking getting worse? Is there pain, headaches, locking, limited opening, or muscle fatigue developing? Are symptoms tied to stress or poor sleep? And third, get evaluated by someone who actually understands TMJ mechanics and function. That evaluation might include looking at jaw movement, muscle tenderness, bite relationships, wear patterns, airway issues, clenching habits, and likely a CBCT imaging to view the TMJ in 3 dimensions when necessary. Treatment completely depends on the cause. Sometimes it involves reducing overload and inflammation by just simply changing your habits. Sometimes physical therapy or myofunctional therapy helps. Sometimes splints can help. And sometimes even orthodontics or bite correction can be part of that solution. Sometimes airway and sleep issues are actually major contributing factors and should also be addressed. Every patient is different, but what you don't want is years of compensation while the system slowly gets more unstable. So let's bring this all together. A clicking jaw should not automatically terrify you, but it should also not simply be ignored forever. The click itself usually is not the enemy, it's the message. And when your body repeats that same message every time you open your mouth, it's probably worth listening to. So if you're in Las Vegas, come see us at Hamilton and Manuele Orthodontics. And if you're not local, head over to vegasorthodoc.com where you can securely upload your records and we will review everything together remotely to help determine what may be contributing to your jaw, bite, airway, and long-term function. My name's Dr. Jeremy Manuele. Thanks for watching. And remember, don't forget to subscribe if you haven't already, because as always, your smile, bite, and jaw joints are worth doing right. I'll see you in the next one.